Okay, so here we are. And I want to talk a few things about what's going on in our practice right now. So, we're going to cover a few areas that you're seeing in the YouTube description. Number one is one with a patient. Patient comes in with his wife, and I love it when patient comes in with their spouse. I want the spouse in the operatory. The patient said, "I want to get all my upper, or I've already had all my upper teeth out. I want to get my lower teeth out too, and start from scratch. I've got an upper denture now. I gag. I can't wear the thing. And what can you do?" So I look at the denture. The denture doesn't fit very well. The denture also looks like a watermelon seed. If we take a look at the buccal flange should have an S curve to it. And as we get more advanced here, I'll show you that. But right now, this is my first video using the StreamYard platform. So we're trying this out. Um, could I stop him from gagging? No, I can't. And he has a flat palatal vault. Plenty of bone for implants. Plenty of bone for implants. And he gave me some doubts about spending the money on dental implants, which I understand, but that's most of our patients. This person happens to be fairly young. He's in his 40s. And so we've got to look at what's caused him to have the problem. And on the lower arch, he has multiple areas of decay. He wants all his teeth out. I said, "I don't think you need all your teeth out." He said, "Take a look at these." And he pulls his lower lip down. I said, "Well, it looks pretty ugly. Maybe you do need them out." Then I looked at the CT scan. And we charge nothing for the CT scan. It's $99 for everything. Examination and CT scan, full mouth series of x-rays, and at least a half hour, 45 minutes with me, and another 45 minutes or up to an hour and a half, or maybe even more with the staff. So we don't want the price of the examination to get in the way of my getting all the diagnostic information. So I scrolled through all the teeth, and he had on the lower right side, he had bad decay in teeth numbers 28, 29, 30, 31, 32. Those have to come out. But he has teeth numbers 20, 21, 22, 23, 24, 25, 26, 27, 20 through 27. Those teeth are okay. We clean them up, maybe a little bit of caries removal, and he can keep those teeth. So particularly when we're talking about budgets, and he's saying, "I'm concerned about the money. I'm concerned about the money. I'm concerned about the money." It is not my goal to get as much money as I can out of the individual. I understand money left on the table. I've heard those sales terms. It doesn't apply to dentistry, does it? No. Essentially, what we have is full upper arch, which allows them to place some implants. We can put a fixed prosthesis on the upper arch. We can do that. On the lower arch, for now, we can save teeth numbers 20 through 27, clean them up, extract numbers 28 through 32, and he can function on those 8 teeth just fine. Then later on, we can add an implant to number 29, implant number 30, or maybe 28 and 30, but do 2 molar teeth. Don't charge them for fixed bridge. Just do 2 molar implants in number 28 and 30 area. He'll have plenty of teeth to chew on. And if he still needs another one, we can put one in tooth number 19. And he can build on this. I can't tell you how many patients see that, hear that, and know they have options and decide to do all 3 implants at one time. They do. Not everybody does. As far as I'm concerned, they can do 1 implant at a time. I'm going to give him the comfort that he needs. He'll be able to chew on the remaining 8 teeth that he has on the lower arch while he's adding on to the lower. He can do that as a function of what he can afford. He wants to have all his teeth out under sedation. So I can say, well, under sedation, if you want us to put the implants in, you can. If you want to wait, we can do another procedure under sedation when you're ready. Give the patient the option. When the patient has the option, he can do what he wants. His wife made an appointment with me as a result of that conversation. This is a trust issue. We're going to go into trust in a moment because I want to talk to you about a personal experience that I've had. Maybe you've had it too. Okay, it's with my physician of 10 years. And he's wanted to run a particular blood test on me that I do not think has any validity whatsoever, and I've done a lot of reading on this. And I understand that different people have different opinions, but understand also that there's a lot of bias in medicine, just like there's a lot of bias in dentistry, just like there's a lot of bias in every aspect of care or every aspect of life. I made a personal decision not to have this particular blood test run. And he and I have been fighting about this over the past 5 years because he found out that I had flunked that blood test at one time and wanted to do follow-up care. I'm seeing for a particular reason. He's not my general physician. My general physician understands me, but I see this particular practitioner 4 or 5 times a year to follow up a chronic problem that I have that we've worked through quite successfully, and I'm doing just fine. I'm really not worried about it, but I do need to get a blood test done. I do a blood test done in order to be able to measure basic stuff on a CBC to see that I'm staying under control, and if not, there's some remedies that we can take care of. Well, he bugged me about this particular test again. I said, no, I don't want this test. It's not what I want. Well, he's taking my blood anyway. He takes my blood and does the CBC, and we get the results of the CBC. The next day I hear from Quest. The guy ran the blood test that I didn't want. He also ran a few other tests, which I had just had done a month ago with my general physician. So I texted him. And I said, you ran the name of the test, ? And he came back with a couple of laughing emojis. I wrote back, not okay. He wrote back, well, I'm looking out for your best interest. How do you feel about that? In the comment section, put in what would you do in that situation? It's a trust violation, isn't it? Didn't I say not to do it? I mean, just from a one-on-one basis, I said not to do it, and he did it. Now, you can look at all the medical things. Yeah, informed consent. Good. I gave no consent. It's a trust issue. I've been pretty friendly with this doctor for quite some time. What would you do? There's no such thing as paternalism. It's not an emergency. Even from a cost standpoint, look at it. Okay, so it's paid for because I'm eligible for Medicare. I've got my supplement and it's all paid for. Is it really paid for? No. It's you and I paying into the insurance company, which then pays the lab, pays Quest. What would happen if I were paying for that myself? $200 lab bill, $300 lab bill that he decided to do on his own. Trust issue. It comes up in dentistry too. Yes, I'm going to confront him. A laughing emoji, and then he paternalistically telling me he's thinking out for me. No, that's not the way it works. I make my own decisions in healthcare. It's an emergency. I can't control it. This wasn't an emergency. It's not an emergency. And we'll see if he's apologetic. He says, I was being a wise guy, or I went beyond the pale. Fine, we all make mistakes. If he doubles down on it like he did in the text, well, what do you think I should do? No, I'm not going to write a medical complaint. Why would I do that? I'll find another physician. So that's what I would do. Next thing, I created some videos. I've done a couple of videos in the past couple of months. I just want to show you, with regard to crown lengthening, a PowerPoint video and see what you think about it. Reasons why a crown may not work and how we can make a new crown work for you. Let's take a look at a tooth with the gums gone, and you'll see the tooth and the bone. And between the bone and the tooth, there are those red fibers. Those are the periodontal ligaments that hold the tooth in place. Surrounding all of that is the gum tissue. And there is the enamel of the tooth. So you see the dentin underneath and the enamel of the tooth, and that forms the tooth. When we prepare a tooth for a crown, we grind the tooth down with a 7-degree taper, and then we'll put a crown in place. Notice where the crown ends. And the crown will end very close to the gum tissue without violating the gum tissue. But what often happens is the tooth structure is lost due to decay, and we have a tooth, therefore, that's very short. What the dentist might do to make it longer, to hold on to the crown better, would be to separate the attachment. But notice what happens. The gum tissue becomes inflamed as a result of the crown entering the area where the gum tissue is supposed to be attached to the tooth. Cause redness, and sometimes the crown will just fall off. So we can't violate this attachment. What do we do to prevent that? And what we'll do is to pull the gum tissue back. We'll do a little bit of an adjustment to the bone so the prepared tooth surface is above the bone, and then put the gum tissue back in place. We allow that area to heal, and then we prepare the tooth once again. But notice where the preparation ends, short of the gum line. Now we can put a crown on the tooth that doesn't violate the attachment. It's comfortable, and because the tooth has sufficient length, now the crown can stay in place without violating the gum tissue attachment. If you have any questions, just let us know. We'll be happy to explain how a crown lengthening procedure may benefit you. So I hope you like this. Hope you benefit from this. Yeah, this is not my living room. It's a background that I just put up. Put your comments in if you want to hear something, see something. Yes, I'm a seasoned periodontist. Some of you know that. Some of you are brand new. But yeah, I still see patients twice a week. Don't do the work anymore, but I certainly talk with them and come up with treatment plans that they can accept, whether it's this level treatment plan or whether it's this level treatment plan. The two doctors here who now own the practice, Dr. Michelle Furtado and my son, Dr. Matt Sheldon, deliver beautiful work. So I have the opportunity of being here, staying in the profession that I love, actually having some material that I can give to you if you find it to be beneficial, and still stay within the profession. Look forward to hearing from you. See you again soon.